everyone. It is 2:30. Welcome to Cook County Health Department Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department, and I am your host and moderator for your weekly webinars. Let's get started. As usual, I wanted to share our meeting objectives, which are to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions that you have, and provide latest contact information and resources for CCDPH. Just to let anyone know who isn't aware, all of our webinars are recorded and they're uploaded to our website as well as our CCDPH YouTube page. We begin promptly at 2:30. I don't believe in wasting anyone's time. Please keep your line muted and the chat will be disabled during the presentation and we will turn it back on for Q&A. Here is CCDPH's contact information. If you are interested in looking at our website, our school-specific website, if you'd like information on the vaccine, there is a vaccine communication tools website that has downloadable information on there that you can use to print and put in your various locations and use as resources. If you would like to submit line lists, report communicable diseases, or have any metrics questions, there's our CCDPH communicable disease reporting email as well as our general email. Please send all EpiPen requests to me, Kelly Jones, at kjones1@cookcountyhhs.org. Please type all your requests and make sure your requests come from a medical professional, i.e. your school nurse or the person who's been certified in the administration of medication. Cook County Health Department is available to pass out resources to communities, and you can complete the form with the link provided, or you can send an email with any questions that you may have, and we can provide things such as masks, shields, goggles, hand sanitizer, thermometers, etc. Please look at the following website for more information on those requests. We'd like to know how we can help you support your school in getting your students vaccinated. I'm sure with the advent of the approval of the ages 5 to 11 vaccine, schools are want to start doing vaccination clinics. We'd love to help you get those clinics started. So please submit your request at the link provided. It will also be in the email that accompanies the webinar. As we speak, Cook County Health Department is at Chicago Ridge Mall. For those people who participated in the last session, they can come and get their second dose, their booster doses. And I have been informed by our Director of Nursing that they do have the pediatric doses available. They are there until tomorrow from 11 to 4. Here's just a few of our partner events that are going on right now. There's a vaccination event at Summit Park District tomorrow from 10 to 4. And is also in Spanish. We have a vaccination event that is at the Village Hall in Marionette Park coming up tomorrow. Tomorrow is a very busy day. There is a vaccine event at Mission Covenant Church in Blue Island. There is also one at Union Evangelistic Baptist Church in Chicago Heights, as well as New Beginnings Baptist Church on Lexington in Ford Heights. That comes on the following weekend, so we got a little time for that one. This is a partner event that is coming up next Saturday. It is in partnership with Cook County Health Department, but it's also sponsored by the Association of Physicians of Pakistani Descent. So we want to make sure that we get this information out, and they're doing an all-encompassing event, in addition to COVID-19 vaccine. They're offering blood pressure screenings, diabetes education, blood pressure screenings, and the like. So please send this out, and there'll be separate accommodations for men and women to make people most comfortable. Here's just a screen grab of our Cook County Health Department calendar with our upcoming events. If you click the link, it shows way more than the events that I've just advertised. Those are just a few of our partner events, but it gets updated regularly, and we're trying to really deploy our resources into the community. If you'd like to request an on-site school clinic, again, you can click that vaccination link or email the people that are listed at the bottom of the slide, and we can get that going, and we can partner with you all and set up that vaccination clinic. Here's information on how you can host your successful event. So you can download the information or view it at our website. It'll just give you some tips on how to set up your vaccine event. Here are some downloadable educational resources, and they're available in English and Spanish. And our YouTube campaign for our My Shot campaign. There's some great YouTube videos that shows us out in the community and with some testimonials from the community about getting their vaccine. More information on that My Shot campaign. And if your school has an existing testing program or needs some assistance getting that together, we'd like to know about it. Please fill out the survey at the following link. Again, information on how to access that rapid antigen Binax testing. Or if you'd like to set up shield testing with your school, you can email IDPH at this email address and they can set that up for you. They are no longer able to do the Binax testing requests unless you've already set up Binax through the state because they're just a little overwhelmed with the Binax testing. If you'd like to have a representative from our Speakers Bureau come to your event to speak on a COVID-related subject, the information is at the link supplied. And we are also able to give you a ride to your vaccination appointment. You can call the 833 number to set up a ride for your appointment, as well as you can call the same number to set up an appointment for someone to do an in-home vaccination. And just more resources for schools for setting up vaccines and clinics. And that is it for me. So I will stop sharing and I will toss it to Lex. Good to see you, Lex. I like your hair.
Thanks. All right, give me a second, everybody, to pull up my screen. All right, not too much new information, just metrics updates, talking about the vaccine a little bit, and just one submitted question this week. Oh, I forgot to take Halloween guidance off the agenda. Hopefully that went well for everybody. We'll know in about 2 weeks whether we see an uptick in cases due to the actual holiday. You guys know, as per usual, how you reach us. There's an epi on call for outbreaks that happen after hours, including on the weekends. But otherwise, please give us about a day to 2 days to respond, depending on the urgency of the question. And I just wanted to remind everybody, if you go to our school website, and you're maybe have some questions about how to report or things like that, we've got directions posted there. We also have the form you need to fill out to report cases and contacts, where you can download it. So that is right on the site, and then provide as much information as possible when you fill out that sheet or when you email us with a question. We need names, dates of birth, any kind of dates of tests or exposures. We need that information to look them up in our laboratory system to keep track of, look at their tests. So many people end up having the same names or the same age with similar names, so we need that information just to locate the correct records. So when you aren't sure whether you need to report something, but still have a question, if it's not hypothetical, provide names, dates of birth, things like that, so we can answer it more thoroughly by looking up any information we have on our end in our lab systems and things like that. As you know, the outbreak definition changed to 10% of students, teachers, staff within a core group, or 3 cases. So the 10% is if you have a classroom of less than 30 people, then 10% would be 2 to 3 people, and that would be considered an outbreak. I remember in elementary school, my reading class was 5 people. So if anybody got sick in that class, we'd be a little concerned. And then before you contact us about an outbreak, make sure you know that there are 3 or more cases, or it is a small group where there's a few cases. And make sure there's not a possibility that they've had contact outside of the school setting, whether that was in a club sport or a play date or a party or something like that. And then, like I said before, any dates you can give us, birth dates, exposure dates, test dates, all that. Just the more information, the better, so that there's less back and forth trying to obtain that information and more just getting down to, actually acting out contact tracing and quarantining. All right, metrics update. Unfortunately, we are not on that downward trend anymore. We have a slight uptick from the end of October to the beginning of November. You can see it for what we have for less than 20, and you can see it in pretty much the like younger kids and older kid age groups. You can see that there's an uptick. And just if you guys remember last week, I said at the very end of the graphs that we show, that's always going to be slightly undercounted because we're catching up to that data. So this is already jumping higher than it was towards the beginning of the school year, and that's an undercount. So we have seen a significant uptick, and we are back to high community transmission, unfortunately. And with the holidays coming up, we're not going to have much opportunity to jump back down to substantial and keep going lower. In all likelihood, with the holidays, we're going to be staying between substantial and high. So plan for that when you're thinking about whether you need to offer any kind of remote schooling after winter break or things like that. We do anticipate transmission being fairly high or at least substantial, between Halloween, Thanksgiving, Hanukkah, Christmas, all of those holidays. But on the bright side, there are a fewer number of active outbreaks. Some of them are bigger, but there are fewer. And we have slightly increased the percent of the total population with completed vaccine series. I do want to point out now that 5 to 11 is okay to get vaccinated, this number isn't going to significantly change because the eligible population has suddenly gotten bigger. We are always reporting how many people are fully vaccinated in the total population of Cook County. So that number before even the 5 to 11 were eligible, that included them in that count. So that will continue to go up as kids get vaccinated. But I just wanted to let you know what the denominator of that figure is. It hasn't changed. It's still just our total population here in Cook. I also noticed on our school call on Tuesday with IDPH, someone asked about the test positivity in Cook County. And I just want to say a better indicator of where we're at is going to be that weekly case rate, because you guys have done an excellent job of setting up screening testing programs in your schools. So that means test positivity is going to stay a little bit lower artificially because we're doing so much more testing of people who are asymptomatic or are not infected in the end. So test positivity is going to stay pretty low. A better indicator is what the community transmission level is and our weekly case rate. A couple of those Gulf Coast states were added back onto the no-go list, but if you wanted to take a field trip to Washington, D.C. and Maryland, that would be okay. But again, recommendation is don't travel if you're unvaccinated. Next week, I'll have like a best practices for seeing your family during the holiday season slide up. So if you guys wanted to share that with your schools or just put it into practice for your own family. But right now, if you're unvaccinated, not the best idea to be flying anywhere or crossing state borders when the cases are really high in those states. And then Pollock made this really nice table that's really well laid out that goes over like what kind of travel and your vaccination status, what the best practices are. None of this information has changed from the previous weeks, but it's much better organized in this table here. All right, and I just wanted to note that kids can start, 5 to 11-year-olds can start getting vaccinated as of today. There are walk-in you can just walk in at any Cook County Health site, or you can call and make an appointment. And then, let me just check my calendar. Yeah, on Monday, you can start booking appointments online. If you are going to the site, just remember that a parent or legal guardian does have to accompany any minors who are going to get vaccinated. All right, and just because there's been a little bit of confusion about test to stay still, IDPH has this really handy flowchart that I think is really helpful. And I have, in case this is like a little smaller blurry for some of you, I have the original link to it on the top link, and then this is just the actual page that came from. So going through this, The first question you have to ask is if everyone was properly masked. And if the answer is no, or you're not sure, test to stay just isn't an option. Then you have to exclude. If everybody was properly masked, then the next question is, are we able to test this student on site at the school on days 1, 3, 5, and 7 with an approved test, whether that's Binax or Shield or any of those other approved tests? If the answer is no, then that person has to be excluded because on-site tests are what we are asking for tests to stay. If you can provide those on-site tests, then you can implement test to stay protocol. As long as that person stays negative, they can participate in school extracurriculars as long as they stay masked and properly distanced and are always monitoring their health, of course. So hopefully that helps a little bit. These yellow boxes are really like just the points you need to consider when you're thinking about test to stay. Masking, testing on site, and the results of those tests. That's what's really important with this. All right, next question, or next slide is just the one submitted question we have. And again, I left the band and orchestra guidance up in case people are going to be having like a Holiday Pops concert or something like that. So the question we got was, what guidance can you provide related to playing touch football at recess? And I confess, I had to look up what touch football was because I thought there was just like flag football and tackle football. But if you're playing touch football, just, hands-on, that's generally safe regardless of vaccination status when you're playing outside. If there's a lot of like really close huddling and touch turns more into a tackle or wrestling situation, then masks should be worn if you notice that that's something that happens often. Otherwise, in the outdoor setting, at recess, they don't have to be masked up unless, that person's doing test to stay or something. And then in order for touch football to be happening, you should have someone monitoring that play really closely to make sure that anyone who should be masked is wearing a mask properly and determining, like, today was a really bad day for tackle and wrestling and huddling, so that actually there was close contact in this scenario. So just make sure you have eyes on it, but otherwise that's a totally fine option for recess. And then as usual, the reference slides, we've got our PCR return to school slide, a slide on Shield FAQs, pardon me, the difference between isolation and quarantine, what to do with symptomatic household members and their people who are still in the school setting, how to pick the right quarantine option, what to do when someone might be experiencing side effects that could be due to the vaccine, but also overlap with the side effects of flu or COVID. Even if you get the flu shot and COVID vaccine reactions would probably be quite similar. Annotate. Sorry, I don't, Kelly, if you got this request, an annotation request, I've never seen this before.
I didn't get it maybe because you are presenting right now.
Mm.
I'm not sure what that is.
I have the option to approve or decline.
Just because we aren't certain,
Yeah.
let's decline it and table that.
I
Continue.
apologize. We'll look into it for next time, but just take notes. That's a nice feature. I guess I would have liked that when I was in virtual school. But anyway, for what happens if you're having possible vaccine side effects and at what point someone needs to be excluded with those symptoms. If you're someone who is looking at daycare and pre-K guidance because it's attached to your school district or you're just attending from those settings, here are all the links to guidance for you. And if anybody is interested, I compiled a list of literature and talking points for vaccines in kids in case you want to share that with a hesitant parent or you're hesitant yourself. Just some studies you can read over. And that is that. Let me stop sharing and we will start the Q&A.
While we're waiting on questions in the chat, I'd love to hear from the person who requested the annotation. Can you tell us what it is and what it does? Going once? That's okay. We have some questions in the chat. You guys can go ahead and tackle that.
Alrighty. So the first question is similar to the rest of these test to stay questions, and that is, what happens if we don't find out a student is a close contact until day 3 or 4? Can they still participate in test to stay? And the next question is basically the same thing. If a student misses the first day of test to stay, what are the next steps?
This is all in the FAQs. This is all in the guidance. We highly recommend that you review those, but in short, whenever you find out 3 to 4 days later for the then follow up from the time from exposure. So let's suppose you found out on the fourth day of the fourth day since the exposure that the close contact was exposed, and the monthly 5 and 7 days of testing days can follow. With weekend, you can test the next available day that the person is in school.
All right. Also, test to stay question. If a student is in test to stay, can they still go to after school or school sponsored activities?
As long as they are consistently masked and socially distant, because the requirements for being in test to stay should apply wherever these students would be going later.
All right, so I missed this question earlier. Did you mention that all CCH sites are doing the pediatric vaccine right now, like the Arlington Heights testing vaccine location? The email that we received said that any official CCH site should have pediatric vaccine. So I don't know specifically about Arlington Heights, but that is what the email said. So I think there's a good chance that's got it.
Oh, I just saw one question about the vaccinated students ages 5 to 11. You will follow. We don't have the guidance from IDPH yet, but I'm for now just follow the same guidance as you would for vaccinated students ages 12 to 12 plus. And please send specific questions to our ccdph_schools@cookcountyyhhs.org.
Next question. A student is home because they have a symptom and they send in, I'm assuming, an appropriate negative COVID test to be able to return. However, they continue to stay home for another 5 days, I'm guessing because they still feel ill. Is the COVID test submitted enough, or do you need to ask for another test?
If on the decision tree, it actually says student is home with a symptom, sends in a negative COVID test. So this is a lab-based PCR because anytime there is a symptom for them to return, it has to be lab-based PCR. We do not accept, I think in the slide, Lex, it says which test we are accepting, and we are only accepting rapid PCR if the student did not have any close contact. And as long as the student symptoms are improved in this scenario, then they can come back if it was a lab-based PCR.
On the other hand, if their symptoms are getting worse or they get new symptoms, then they will have to retest. But if
PCR.
Yeah, if they've just stayed home with the same thing and it's getting a little bit better, then that's fine.
How do we collaborate with CCDPH to perform test to stay? It's if you have shield testing program, just follow the flow chart and just let us know if those tests, which ones are the close contacts, and then we are letting you handle all those, taking care of which days the students are being tested. And then let us know if one of those close contacts does become positive, and then they have close contact, and we'll do all the contact, with case investigation.
All right, next question, and the last one that I see. Can Binax tests continue to be used after the extended expiration date?
I'm gonna have to look up. Maybe you might want to answer other question. Let me look up email by Jackie Carfix because she did have to deal with a lot of these questions.
While you're doing that, I can answer the next question, and
Mhm.
that is, can you use Binax to screen for kids who can't produce an adequate saliva specimen for a shield? Yeah, if you want to have a screening program and use Binax tests and you have enough supply, that's totally fine. I know some younger kids have been sometimes having problems producing an adequate specimen.
Lex, I think you missed one. I'll read it to you. Will students age 5 to 11 who are vaccinated need to be excluded if they're close contacts?
Uh, if they are fully vaccinated, and that's not going to happen for, well into the holiday season, then they don't have to be excluded because they'll be fully vaccinated. Excuse me, guys. Um, unless IDPH comes out with other guidance, and I don't think they are going to say they need to be excluded, they should just be able to carry on monitoring their symptoms for the next 2 weeks.
I just got the answer from Michelle, who quickly looked up about the expired Binax test. They can be used as long as they are in a controlled environment. It doesn't matter what the expiration date was.
Okay, great.
Thanks, Michelle.
I guess we'll give it a second for anybody else who has any other questions, but otherwise we'll turn it back over to Kelly.
Sure. I have some thank yous for Palik and Michelle in the chat. If you have any other questions, please, this is your time to enter those in the chat. Otherwise, we'll be finished at record time. And here's one. Denise didn't want us to get out early. I'm just messing with you, Denise. Here we go. There's one more.
All right. If we have a close household contact who displays symptoms during a quarantine period and the parent refuses to test the child, are we going to call them a presumed positive and contact trace that student? Or without the availability of testing, do they have to get tested in order for them to be considered a case and for us to trace their contacts? That scenario is mentioned in the decision tree, which I'm going to link again in the chat. Go ahead, Pollock, if you have anything else to add.
No, yeah, I was just going to say that. I did want to mention one more thing. Thank you so much for trusting us with asking all the guidance questions. We are trying our best again to respond back as soon as possible. However, we would like to request that when you do send us questions for guidance and it's some scenario like we have a positive student who is this, they have close contact, any of those details. It would really help us when you give us that scenario. We would need the name of the person, case, date of birth, address, so we can look them up right away in our system. And also if we have already begun investigation in case. And also please describe the symptoms. Most of the emails we do receive, we get the symptoms, but it would be nice to have all that information right away when you're asking us questions. That way it reduces back and forth on both of our end. So we can help you right away look up in our surveillance system if that person was already reported through lab or the provider regarding test. So that would be very helpful. I think test to stay on the bus, it's they're allowed to now be on the bus, but I'll double check and find out. And you can email us, that way we don't forget and we can respond to you.
Especially, we're well
Oh,
aware.
you already answered. Sorry, Lex.
No, that's fine. We're well aware of the busing shortage. We know it's already hard to get some kids to school. So as long as they're able to maintain distance and masking, you can make that work. To address the next question, 3 feet is the close contact definition for a classroom setting or an
Mhm.
extension of the classroom setting, like if it's just that class in a computer lab or in the library.
Okay, I think that is it. If there are no other questions, oh, I think Kimberly had a follow-up, unless it was answered. If they can't be 3 feet, then no bus. I think that says correct. Correct, yes.
Yeah,
Mhm.
that is the ideal situation if they are able to get themselves to school another way, but we understand parents work and things like that. So that shouldn't be a barrier to keep kids out of school. But if it is possible for them to get to school another way in that situation, that should be the case that they use that other method.
Okay. You're welcome, Lauren. She says, thank you all. If there are no other questions, then I want to thank Lex and Michelle and Palak for your hard work and answering all the questions. We will see you all next Friday, same bat time, same bat channel. And you guys have a good weekend. Enjoy a little sunshine. I think it's supposed to snow next weekend. So have fun. Bye. Have a good weekend. Bye.